This video clip will relate to some of the examination basics relative to examining active and passive thoracic extension. Patients coming to us with poor posture and excessive kyphosis is one of the biggest things that we see in clinical practice. So it's nice to be able to quantify that and test this with both active and passive movement. A nice way to quickly quantify how much thoracolumbar kyphosis our patient has is with one of these inclinometers. And all we do is we take the inclinometer and we place it right over the T1 spinous process. We place the middle portion of this right over the T1 spinous process. We come down to eye level, and having zeroed the inclinometer out against a vertical surface, we take a measurement as to how much kyphosis our patient has. Now, Hannah, I'm going to have you go into a bad posture just for the sake of the video here. Okay? Bad postures look a little bit more like this. Any reading over 40 degrees, your patient has too much thoracolumbar kyphosis. Now come up to your normal posture, Hannah. Hannah doesn't have anywhere near that amount. Okay? But this is a very simple and quick way to quantify how much thoracolumbar kyphosis your patient has and whether or not it's over 40 degrees. Okay? Now, how does your patient get out of having too much kyphosis? They have to have the ability to actively extend their thoracic spine, both upper, mid, and lower. So we'll look at the patient's ability to actively extend, and if they can't, if it's clear that your patient stays in kyphosis, that's when we have to apply passive segmental extension and examine which segments in particular are not extending. So we're going to get behind the patient just a little bit and to the side. And Hannah, I'm going to have you do 3 repetitions of thoracic extension. Now, for your patient, what you'll tell them is you'll tap their breastbone gently and say, I need you to lift your breastbone up and forward, like that. Okay? Now, I'm going to first look in the upper thoracic region. So Hannah, please lift your chest bone up and forward. We're looking to see if the kyphosis reduced, if it flattened in this area. Remember, there's no way you can see all 12 thoracic segments at once. Now I'm going to put my focus to the mid-thoracic region. Okay, please lift your chest bone up and forward. Does the thoracic kyphosis go away? And in Hannah's case, it does. Her spine moves very nicely. And now go back to kind of your regular neutral posture. Now I'm going to focus on the lower 3 thoracic motion segments, T9 through about T12. So please try to lift that chest bone up and forward one more time. And again, you can see that Hannah is able to completely come out of kyphosis. So she has nice thoracic extension. Unfortunately, many of our patients do not. They're not able to actively come out of kyphosis. So let's examine which segments passively might be the most stiff. The segments are not able to extend. Okay? We'll look at upper thoracic first. So Hannah, if you could just interclasp your fingers behind your neck, like that. To study passive segmental extension in the upper thoracic region, we just need the patient to interclasp their fingers behind their neck, and we just need a grip right on the distal end of their elbows. This is an extremely simple procedure where we just move the elbows in an upward direction. And this allows us, through this nice long lever arm, okay, through Hannah's arms and forearms, to extend her upper thoracic segments. I think the camera probably shows that she extends pretty nicely. What we're feeling for is the spinous processes not coming together, in other words, the segments not extending. And visually, during this test, we want to see that with this passive movement, whether or not the kyphosis remains. If it does, then we know we have active and passive motion loss in the same direction. Now this grip can be used for the upper and mid-thoracic, but I'm going to have, for the sake of the video, Hannah, just change your position. So I want you to do a kind of a crisscross pattern and then elevate your elbows. Okay? And now I want you to bring your head and neck forward just a little bit, so your just neck relaxes right there. Now I'm going to go to T4, and I'm going to extend. And T5. Do you feel extension being recruited into each of these mid-thoracic segments, as evidenced by feeling the cranial spinous process move downward? And again, use your eyes. You can tell that Hannah's extending really nicely. Now I'm starting to move into the lower thoracic region. You can maintain this exact same upward movement of her arms, or if you're having some difficulty recruiting extension into the lower thoracic region, note how the movement pattern is going to change. Here, Hannah, I'm going to pull your arms forward just a bit like this. And sometimes a movement pattern that's sort of upward and a little bit forward helps you to recruit extension into those lower thoracic segments. Again, use your eyes and feel the inner space. Your eyes can tell you whether or not you're able to passively reduce kyphosis in either the upper, mid, or lower thoracic. Hand at the inner space, spinous process should be coming together if the motion segment is extending.